Can PCOS patients conceive naturally? PCOS is one of the leading causes of infertility, so patients are always concerned if their fertility will be affected by PCOS, and they keep questioning us if they can conceive naturally even with PCOS. Hi friends, this is Dr. Rajeshwari Reddy. I'm an obstetrician, gynecologist and a laparoscopic surgeon from Hyderabad. Yes, of course, women with PCOS can conceive naturally. It may take some time and a lot more effort to do so. Let me first explain why it is just so difficult for women suffering from PCOS to conceive. Firstly, they have a very irregular cycle which makes the ovulation time completely unpredictable, although ovulation is always a constant thing in any menstrual period, which is the whole cycle period minus 14 days. Secondly, PCOS patients have anovulatory cycles. So, if there is no ovulation, then there cannot be fertilization. Third, the intrauterine endometrial dysfunction caused due to PCOS does not favor implantation due to the hormonal imbalance. So, what should we do? Now, I am going to give some tips to overcome these issues. Start with the sustainable diet and exercise program. There is no one program that fits for all, but basically one must follow a sugar-free diet and choose foods with low glycemic index, include more proteins in their diet. The three main points to concentrate are quality of food, quantity of food, and timing of food. All the three are equally important. I have to emphasize repeatedly that all the three factors are equally important. Exercise regularly, concentrate on losing belly fat. I have made a separate video on food and exercise for PCOS. So please go through them for better understanding on how you should plan your exercise regime and how you should plan your diet. These changes will naturally improve the quality of your egg, and so it will improve your ovulation chances. In addition to these lifestyle changes, simple ovulation induction medicines will also increase the chances of conception. Regular ovulation will make the menstrual cycle regular too. One can use a ovulation kit to predict ovulation, but a follicular study will be a more apt method to detect ovulation. Staying sexually active during the ovulation time also increases the chances of pregnancy. Having a good sound sleep is very essential to keep PCOS in check. Practice meditation to keep emotional harmony. When in stress, cortisol is released, which is a stress hormone, which in turn affects the health in toto, and of course, ovulation too is affected. It is a good idea to reach a body mass index of 23 to 26 and have normal thyroid levels and also normal sugar levels before planning for a pregnancy. My advice to all PCOS women is to maintain optimal health and good lifestyle and do not postpone your pregnancy beyond the age of 29 to 30 years if you want to conceive naturally. In PCOS patients, even the AMH test, which is done to see the ovarian reserve, is a little misleading because PCOS patients always have high AMH. So one cannot assume that because there is high AMH, we can still postpone the pregnancy. So in a nutshell, if you want to conceive naturally while you are a PCOS patient, then the most important thing to do is maintain a good, active, healthy life, good exercise, good food, and maintain a body mass index between 23 and 26, And of course, it's advisable to go for follicular studies, track your ovulation, make out whichever is your ovulation time, and then have regular sexual activity at that time. Since the periods are irregular, once the ovulation starts, either by weight loss or lifestyle changes or by ovulation induction medicines, then the cycles also becomes regular, and thus it is more easy to conceive naturally. Thank you.